Hey, it's another day where we are alive and so is public health. Welcome to Better Together. Last episode, we introduced ourselves, who we are, what we're trying to do, and why we think a podcast from a Lakes Region public health nonprofit is a worthwhile addition to a world that already has roughly 17,000 podcasts about everything from true crime to competitive cheese ranking. I want to answer the follow-up question that I'm sure all of you had listening to our last episode. What do we actually do? It's a fair question, and the answer is genuinely less boring than it sounds, which admittedly is a low bar, but we're going to clear it. Today, we're going to dig into just that question. What do we do? We'll talk about the work that happens before the ambulance arrives, the planning that happens before the crisis, and the unglamorous, invisible, absolutely essential job of making sure the right people are in the same room. I'm Jonathan Lyle Sexton. In a few minutes, I'm going to be joined by John Beeland, someone who has seen what public health coordination looks like from just about every angle this region has to offer. But first, let's talk about the most underrated job in your town. It's time for a pulse check. Quick pop quiz. When you hear the words public health, what comes to mind? If you said vaccines, hand sanitizer, or a poster in a waiting room featuring a cartoon hand aggressively washing itself, you're not wrong. Those things definitely exist, and public health is involved in those things. That answer is roughly as complete as saying the fire department is those people with the Dalmatian sometimes. It's technically accurate, but it's incomplete. Research from Harvard's T.H. Chan School of Public Health found that while most Americans say they're familiar with what their public health department does, the vast majority associate it with infectious diseases and vaccines. The broader work, the emergency planning, the community coalitions, aging services, seatbelts, air quality, fluoride, life jackets, putting a fence around your pool, it barely registers. Which means public health as a field has done an extraordinary job of solving problems people never knew existed, and a considerably less extraordinary job of explaining what it was doing the whole time. It's a bit like if someone salted your driveway every November before the first freeze. They never left a note, they never sent a bill. Well, that's also how public health gets budgeted, but we'll talk about that at a different time. That's public health. It's the quiet prevention of the fall. They never get credit for the ice that wasn't there. So what does PPH actually do? What do public health networks actually do? I'll give you the version I tell people when I'm waiting in line at a coffee shop and they ask what I do for work. I generally get a long pause after explaining it and a slow blink and half-interested nod before they start checking their imaginary text they got, but I'll start it with a river. There's a parable that gets told a lot in public health circles. It's been told at almost all the public health conferences since about 1990, but it still works. A group of people are walking alongside a riverbank when they hear a child screaming for help. The child's caught in the current. They jump in, they pull the kid out. But before they can even catch their breath from pulling the first child out, they hear another one. Then another. They spend the whole afternoon pulling children from the river, exhausted but doing everything they can and doing heroic work at the same time. But at one of those points, one of them just gets up and starts walking away. Someone grabs their arm. "Where are you going? We're saving drowning children here." And they said, "I'm going to go upstream and figure out why so many children are falling in." See, that's public health. The people pulling the children from the rivers are doing heroic, necessary work. Emergency rooms, first responders, crises services. We need every single one of them. But if nobody ever talks about what's happening upstream, if nobody ever goes up there and asks, why does this keep happening? We will always be pulling children from the river. Upstream work is the work that keeps people from falling in. And nobody fell in today is genuinely difficult to take credit for. I mean, try putting that on a grant application. Projected outcomes. Well, nothing's going to happen. You're not going to get funding from that. Here's the thing about upstream solutions. Most of us have already benefited from them and never thought about it twice. You're probably listening to this in a car. Think about that seatbelt you should be wearing. Someone decades ago looked at car accident data and asked, why do so many people die after a crash? Short answer is that the human body wasn't designed to stop at 60 miles per hour. So they decided to put a strap across your chest. Seatbelts now prevent an estimated 15,000 deaths a year in the United States because of that little strap. Meanwhile, I can't even get people to use a turn signal, which also exists. It's also in a car. It's also free to use, and it would make my life a whole lot easier on my commute. Life jackets are also something that we should consider about public health, and we probably don't take a second thought for. We live on a lake. People drown, and almost every time the story is the same. No life jacket. The jacket existed. It was probably on the boat. It just wasn't on the person, which means that the upstream work isn't always about inventing something new. Sometimes it's about changing the expectation, the culture, the habit of reaching for it before you push off from the dock. Upstream work is the education. It's the culture, the expectation that made a change before there was a crisis. You wear your seatbelt, you put on your life jacket, you get your flu shot, and you wash your hands. Upstream work is also about being prepared in emergencies, or what we might call emergency preparedness, or EP. There's CPR, there's stop the bleed training. It gives everyday people the tools to step in during those first few minutes to help pack a wound, start chest compressions before the ambulance arrives. Someone walked away from the river long enough to ask the right question, collect the right data, and turn the answers into a skill anyone can learn. The more people who know these things, not just medical professionals, the better the odds that someone survives the gap between an emergency and help arriving. None of these feel like the public health most people think of. It's not just a flu shot, and it's not a hand washing campaign. Public health may not make the evening news, but when something goes wrong, and it eventually does, the communities where the quiet work happened for years and years that no one noticed are the ones that hold together through the chaos. Nobody salted the driveway and left a note, but nobody fell either. Am I good? My guest today has seen public health from many different points along the river. He's both been pulling people out and walking upstream. John Beeland is the former fire chief in Gilford. He was named the 2025 immunization champion for New Hampshire. He serves on the board of multiple community organizations across the Lakes region, and he also served on PPH's own board, which means he understands this work not just from a partner from the outside, but as someone who helped shape it from the inside. That combination is genuinely rare up here. Most people interact with an organization like PPH from one direction, either as a partner agency or as someone who needed a service. John is often on both ends of the stream. See, a fire chief's relationship to public health is one of the most honest illustrations of why all of this coordination matters. When a call comes in, the fire department responds. But the conditions that led to the call, the isolation, the misconnection, the gaps in services, those were set long before the tones even went off. So John, thanks for being here.
Thank you for having me. That was quite an introduction.
I really try. There is so much to your history in public health. Do you want to kind of just walk everybody through just the small, like a small scope of what you've done in your lifetime?
Yeah, sure. I mean, from early on, I wanted to be a firefighter and came up here from where I grew up down in Salem in 1981, attended the community college fire science program, and then got hired in the Gilford Fire Department and spent my entire career there because I just absolutely love this part of our state. So I went through all the ranks there. I started as a live-in student, where you could actually live in the firehouse while you're going through your school program, and got hired and went through all the ranks, from essentially a volunteer to the fire chief, and retired in, hard to believe, 2011.
Oh my gosh.
Yeah, 15 years now. That doesn't even seem possible, but it is. And from there, I went and spent 7 or 8 years up at the Lakes Region Mutual Fire Aid, which provides emergency communication services for, I think they're up to 36 towns and cities here in central New Hampshire. And they also provide a whole host of other value-added services, such as emergency response, emergency communications at scenes. They have a training division. So it's a very robust organization, and we're very fortunate to have that here. And then from there, I came here to the Partnership for Public Health. When I retired, from the fire department, I was approached by the director of PPH at that time, which was Lisa Morris, and about coming on to the board. Mm-hmm. And I was right up front with her. I didn't know a whole lot about the organization other than being during my fire service time. The region has an emergency preparedness council that is managed through the Partnership for Public Health, and is their charge is to kind of look at what's going on in the public health world and to prepare the region for anything that might happen in that realm. So I had that little bit of a background, but when I came in to PPH as a board member, I was enlightened very quickly
Yeah.
as to the different things that happen here.
When you were in the fire service, what was that relationship to public health that you were?
Well, if I have to be honest, as a firefighter working on the floor, as we say, that lives in the firehouse, goes out to calls, the connection wasn't there. I really did not know hardly anything about public health other than it existed, and I always thought of it in the terms of a public health department, such as like we see in Manchester
Yeah.
and Nashua. The whole public health network to me was kind of an unknown.
Okay.
Didn't really know that much about it. When I did start to learn more about it was when I progressed up through the ranks and got into mid-management and upper-level management. Then I started to learn about the collaboration that was happening between emergency services. So not just fire, but police, fire, EMS, and the public health network here in the Lakes region. And additionally, I have to say, in 2005, I went through the Leadership Lakes Region program.
Okay.
And that program exposed me to so many different aspects of nonprofits, volunteer agencies, and this whole cohort of people throughout the region that really work hard to fill in the cracks that people sometimes fall through, no fault of their own. They just kind of, just for a lack of better term, is they fall through the cracks, and that's where I really had my first exposure to these agencies. That if these people weren't out there doing the work that they do, we would see these folks in the back of ambulances more often. We would see them in the back of police cars. We would see them in the emergency room. So those services, I was exposed in the beginning, early on, mid-fire service career, through Leadership Lakes region, and then further on as I promoted up, like I said, I learned more about it in the mid-management and upper management level stages of the fire or emergency response.
Yeah. So as you've continued learning and experiencing just the different aspects of what one PPH does, but all of the different public health networks in New Hampshire, what does the emergency preparedness side of that really mean to you? You were the director of emergency preparedness at PPH for most if not all your tenure here. So what does that really mean to you, and what does that look like in someone's maybe daily life that they might not see, right? There's a lot of behind the curtain things going on. What does that look like to maybe the daily person, and what does it really mean to you?
Wow, that's a good question, and there's multiple levels to that. I think that if you go down to the average citizen, street level type thing, there's probably not a lot of connection there in understanding what public health is and how it impacts their lives on a daily basis. But can you rephrase that a little bit there?
Yeah.
That was a whole lot to swallow. And I'm trying to synthesize that together.
I definitely threw two parts at you. So we'll go with the first part of what does EP, emergency preparedness, just mean to you?
Okay. All right, let's bite that piece of the apple first. So emergency preparedness, to me, it's a whole host of things, but Basically, when something happens, there's an event that occurs, and then there's a period of time where the response is kind of happening, and until the public health departments across the state, if it's that big of an event, or the Health and Human Services at the state level is gearing up a response, and then locally, all of the public health partners are gearing up a response for an event. There's this gap period between the event happening and between where the response actually kind of boots on the ground, starts to kind of gear up and begin to mitigate whatever the
Yeah.
situation is. So I think that public health, a big part of the emergency prepared piece of that is to be ready and have the resources to be able to respond in that gap and fill that time and period until the full response can get rolling, if that makes sense.
Yeah.
And I think part of the responsibility of emergency preparedness in the public health networks is to try to get that message out to our citizens that, no matter what the event is, it can be a small event in your own home. Somebody cut themselves, fell down the stairs, broke a bone, something like that. There's going to be a period of time before the professionals get there. And somewhere in my career here in the EP world, I had this paradigm shift after going to a conference and understanding this gap that occurs, and that there are things that folks can do during that gap period between the event occurring and the professional responders either arriving or the response from the larger community gearing up. There's things that you can do. And it really refocused my attention towards trying to get the message out to citizens and get them engaged in activities where they can get some knowledge, get some
Yeah.
skills that would hopefully lead to confidence to manage whatever is happening until those professionals arrive or processes are put in place for a public health emergency that we now have direction on what we're going to do. Does that make sense at
Yeah.
all?
No, I think that was a perfect answer. It ticed perfectly into just a little shameless plug for our CERT classes that you help lead here at PPH of our community emergency response team, where you talk about just that, the little things you can do, sometimes the big things, CPR, stop the bleed, that you can do between the event happening and when help can arrive, and how you can fill that gap. And so the second part of my earlier question was a little bit more about, what does EP look like in action for the community that they might not see necessarily on the front end, right? There is teaching those classes. There are, if a natural disaster were to happen, doing sheltering, stuff like that. There is very tangible items to emergency preparedness, but there is also a whole host of things that happen behind the curtain. Can you kind of bring people in on what are some of those things that they might not see that are all a part of emergency preparedness?
Sure, that's actually an excellent question. So I think that the major role of EP within the public health networks are coalition building throughout the community. The public health networks do not have true, like in what we think of as emergency response vehicles. We don't have an army of staff standing by to respond to whatever the event may be. Our strength comes from going out into the community and recruiting, if you will, folks from across all different disciplines in the community, getting them to sit around the table, understand what community public health is all about, some of the issues that are being faced, either locally, regionally, or across the nation, and then to kind of work together to develop a plan. It's really, when you think about the public health networks, they build whole community response to whatever the different departments within the public health network
Yeah.
are working on. So, when we talk about whole health, a whole community response, we're talking about the business community, the municipalities, the emergency responders, education, certainly healthcare, and probably some more that I'm forgetting. But when you are looking at building a public health emergency response network, or just coalition to make our communities better through public health initiatives, when you have that whole community around the table, your outcome is going to be better. And I think over the years we have proven that time and time
Yeah.
again, in this region for sure, and across the state.
100%. And when you build a coalition like that, there has to be a number of voices that are all competing, not necessarily competing. There is definitely coercion that happens where, not coercion, cohesion that happens where everybody's working together for a common goal. But also right now, I know we are in a time of people don't always know exactly who to turn to, who to look. There's a bunch of different voices all happening. And so last time we talked, in our last episode, we talked a lot about the trust gap that's happening in public health. How do you navigate that on a coalition level, right? Because I'm assuming some of the voices don't always agree when you have a coalition together. How do you navigate a little bit of that tension that's built there? Or even on a broader level, how do you navigate that trust with the community and help build that up?
Yeah, that's boy. If I had the answer to that, I'd write a book and I'd be sailing across the ocean somewhere. That's a tough question, but it's the reality of where we are today. And I think there was always some of that, but it has definitely changed and become a bit more decisive than I ever remember it being in the past. But I think you start with, when you build that coalition, is you try to identify first what it is you're trying to have a positive impact on. Make sure that what you're doing or you're promoting is based on data, on facts, on science, and it's not just something that somebody is pulling out of their hat. Because when you have voices that may be offering a differing opinion, sometimes those facts and the data and that kind of materials will bring somebody around to see that, oh, okay, maybe I didn't have the full picture of what we're trying to do here. And conversely, sometimes those voices, which are always good to have in a coalition, will bring you around to thinking that, wow, we didn't look at it that way, and maybe we missed something. So it's the important thing is to have the right people around the table, not meaning that everybody has to have the same opinion or idea, but that those opinions and ideas can be discussed around that table respectfully and in a positive manner that always keeps the end goal in the forefront of the picture, And I think if you can build a coalition that way with those type of folks around the table, you stand a really good chance of putting together programs or responses that make sense and will lead to positive outcomes. Not to say there won't be hiccups, but you'll get there.
Yeah. Kind of in the same vein, moving a little bit more onto a specific subject. Last year, you were named New Hampshire's immunization champion. Congratulations.
Well, thank you.
Over your time in public health at the fire department, what has changed about the perceptions of vaccines just how to offer them. Right now in New Hampshire, we see a lot of legislation. We see a lot of things coming out, not even just in New Hampshire, on a national level, right? Vaccines are becoming a little bit more of a contested issue. What have you specifically seen change over your many years of work in this field?
So I spent 8 years here at Partnership for Public Health as the emergency preparedness coordinator or director. And when I first came in, let me step back. The partnership has been managing the Vaccine for Children program through the Department of Health and Human Services and at the higher level, the federal government. And it's been a strong program in the schools that is designed to bring the seasonal flu vaccine to children in the schools, and make access for those important vaccines for the kids available in school when the parents don't have to leave work. So it was all about ease of accessibility for those parents that wanted their children to receive the flu vaccine. That's what the program was all about. Prior to my arrival here in the region, I believe that we were administering in our school districts, those that chose to participate, around 2,000 vaccines.
Wow.
And I saw in my 8 years here a steady decline off of that number. I think there's a multitude of reasons for that. I think part of it was, especially in the more recent years, misinformation, outright lies about vaccines. In some cases, I think that vaccines became more available everywhere.
Yeah.
And that, mom or dad could be in aisle number 7 at Hannaford's and see a vaccine sign at the pharmacy, say, oh, let's go get our flu shots. So I think that played into it. And so I think there was, probably a multitude of reasons for that. But I'm not, I'm not the expert. I think I received that award only because of my work here. Really, just trying to get the vaccine to people that wanted it where they wanted it. We kind of bent over backwards to make that happen in the COVID response, as well as in the flu shots. So I don't know if that answered that question, but
No, that's perfect. I think it really brings to light like both sides of the discussion that needs to happen. Of one, vaccines are becoming more prevalent. They're becoming more available in easier places. I know I got my flu vaccine and my COVID vaccine at CVS, right? I didn't have to go schedule an appointment with a doctor. I remember growing up, that is what we had to do. Yep. We always had to go to my doctor to get a flu shot even. And so it really limited the times I could do it. So when my school offered it, my parents were like, heck yeah, do that, because it made their lives easier. They didn't have to, usher me and my brother to our doctor and take some time off of work to make that happen. They could just say, do it exactly where you are. And I think that's a really great point. And I also really appreciate the misinformation side of it. There is a huge amount of misinformation. And we talked about a little bit last week of those sources are coming from a lot more previously trusted sources, I should say. They're coming from a lot more places of authority. And so it's a huge conversation. And I know you're not the expert about it. It's definitely a conversation we're going to be trying to take up on this, but kind of talking a little bit about vaccines, but also, I don't know, COVID-19 specifically. During the pandemic, I was I sat on my couch and watched Netflix and Friends and The Office, and I was not really doing anything. I I quarantined, but during COVID-19, what were you up to? Because it was an unprecedented health pandemic.
Yeah.
And so I am sure the stories you can tell are numerous.
Before we get to that, back to the school vaccines and the flu vaccine. I remember being in a school here in the city, and a longtime nurse who has since retired. We were talking about the importance of the Vaccines for Children program in the school systems, and this was not a hot day to talk. She anecdotally told me that she's like, John, I've been here a long time. And I was here before we had the vaccine program in the schools. And since the implementation of the vaccine program, the flu, and that's all we did in the schools was flu, the attendance rates of the kids up, the attendance rates of the staff up. So absenteeism dropped significantly, according to this school nurse, and attributed, directly to that program. And now that funding has shifted away, that program is no longer in the schools. It was really the collaboration and the teamwork between the Department of Health and Human Services, the state folks. They were working around the clock. They amazed me every single day. The work that they did, and then the public health networks, working with the state to make sure we had clinicians to carry out the work that needed to be done, volunteers to support all of the clinical work being done, and then coordinating the clinics, if you will, or distribution of the vaccine in an equitable manner to those across our region. And working with the coalitions was just, it was a life-changing experience for
I bet.
a lot
Yeah.
of those responders that worked in that response. They were just amazing humans. All they cared about was, being there to help other people and working through all of the challenges that would arise in that response and getting the job done.
Yeah.
And we did, and across the state. So that's I'll always have a ton of respect for the public health networks and for that response. It was amazing.
I think that was one of the first times that a lot of these public health networks were seen, noticed. That's really when, at least in my world, I started realizing public health existed in these different aspects. And I would assume that was shared by most of our community members, most of everybody. That's when public health really became
Jonathan,
known.
I can tell you stories and the volunteers that worked with us. Of course, we did homebound vaccines. So people that were truly homebound would call 211, connect with the public health network, and ask for somebody to come out and give the vaccine to them in their home so they could see their grandchildren, they could visit with family, that kind of thing. And they had tears in their eyes. And, we heard this time after time. It's like, oh, I'm going to be able to see my grandkids, or I'm going to be able to, visit with my children, or whatever. So I think that response certainly connected the average system, average citizen, to the public health networks.
1,000%.
Even though we had to go and explain to them, they're like, "What partnership for public health? What's that?" So it was a great opportunity because we always had to stay 15 minutes post-vaccine to make sure there's no adverse reactions, which, knock on wood, in all of the vaccines we administered, we had maybe one or two, and we're not even sure it was due to the vaccine. But we were able to explain to the people, we had the time to say, this is what the public health network does. And so it was a remarkable experience. In my fire service career, I got involved with 911, 9/11, excuse me. That response in the Lakes region here formed a coalition, brought emergency responders up from the city. Life-changing event for me, and I think this COVID and public health response was a life-changing event as well.
1,000%. Speaking of your 9/11 response, there is now a John Beelan Day due to the work you did that we celebrate here at PPH.
I think that's long forgotten.
Well, thank you, John, so much for your time and coming out here. Was there anything that you really were hoping to say that we maybe didn't get to, or?
You know, I'm sure we could go back and forth for hours on this topic, but I think the greatest thing that if you could get the message out to the citizens of our region and across the state and across the country, is for them to understand that there is a army, if you will, for lack of a better word, of unbelievably talented, hugely dedicated folks that are meeting on daily basis to constantly evaluate what's going on in our world of public health and to come up with strategies to make life better for the average citizen. That's really all they're trying to do. And they're hugely dedicated to that. And without them, we'd be in a lot worse place. You know, they make life better for a lot of people, and they're, like you said earlier in the conversation, they're kind of behind the curtain.
Yeah.
You know, and they're not out there in uniforms driving around in black and white cars or red fire trucks, so the people don't see them in the same light as an emergency responder. They are, but they're just dealing with a different type of emergency. And lastly, I would like to say to anybody that's listening out there is that any type of an event, emergency can happen to any one of us at any time. There will be a time that the event happens before the emergency responders can arrive. There will be that gap period of time where there is something that you can do to help your situation, your family member situation, your neighbor, your neighborhood. There are things that you can learn to do to make your situation better until emergency responders can arrive. And the best place to start is reach out to the Partnership for Public Health and inquire about their community emergency response team training. It's a 9-week program, 1 night a week, and you'll learn all different kinds of skills such as first aid, how to use a fire extinguisher, disaster psychology, how to take care of yourself after an emergency, a whole host of topics, and we have a lot of fun doing it.
Well, thank you, John. Thank you for that little plug, too, at the end. I think that was I think it's so apt. I remember, I don't know if I was overhearing a conversation you had or I was like on the outskirts of it, but you talked exactly about that, of a lot of people just don't think about these emergencies happening to them. We went and did a good news story of the day, and we talked about there's the people who don't think it will happen to them. There's also the people who want to be that person who, you know, sees a car wreck and they get out of their car and they go help people. Yeah. Mm-hmm. But a lot of people just don't know how. So they just keep on driving, or the emergency happens and they don't know what to do. And I think this is exactly a great opportunity to have that it's a great opportunity to learn, to get those skills and to be more prepared.
Knowledge, skills equals courage. You hit the nail on the head, and that's all we're trying to do is give the knowledge, give the skills that people have the courage when they witness some kind of an emergency event, medical emergency or whatever it may be, a fire, they know what to do until those emergency responders arrive, because there is a lot that can be done that will create a more positive outcome than doing nothing.
Awesome. Thank you so much for being here, John.
It's my pleasure.
It really means a lot.
It's always good to be back here.
Yeah, we love seeing your face. So awesome. Well, thank you. What I keep coming back to after putting this episode together is this. The work that holds a community together is almost never the dramatic work. It's the meeting that happened 6 months ago, the data that got collected and actually read, the phone number someone had because they've been in the same room enough times to earn it. Public health is infrastructure. It's the roads that get salted before you drive on them, the pipes that get checked before they burst. It's the plan that exists before anyone needs it. And like all infrastructure in New Hampshire, you mostly don't notice it until it fails. And when it does, everybody wants to know why nobody did something sooner. Next time, we're going to go into something very specific. We'll be looking at something that has touched nearly every family in this region one way or another. It's not a comfortable topic, but it's an important one, and this region deserves an honest conversation about it. Thanks for listening and for sticking with us through the questions, the nuance, and the prepared chaos. We're launching with 3 episodes today, and we'll be back every 2 weeks from now on with new conversations like this one. If today's episode sparked a thought, a question, or a polite disagreement you're still working through, that's the point. Subscribe and follow so you can stay in the conversation and never miss an episode. Feel free to connect with us on our socials. We're at PPHNH or online at pphnh.org. Better Together is a partnership for public health production. It's produced by me and Emma Peterson, who is the ghost in my ear, with technical direction from Tessa Donahue, making sure I look immaculate. The show is written and edited by me, Emma, and Tessa. With a sincere thank you for John for joining us today and helping us have the conversations the right way. We'll see you next time.